The Federal Healthcare Executive Awards recognize outstanding achievement in federal healthcare administration. The American Hospital Association considers it an honor and privilege to be an active partner with our federal health system, which encompasses not only the military healthcare system, the Army, Air Force, and Navy, but also the Veterans Healthcare Administration and the Indian Health Service. The women and men serving in our federal health system are an invaluable resource to our nation. They provide critical care to so many, including those on the front lines of combat, those on active duty as well as their families, those who honorably served our country, and our Native American population. We all share the goal of ensuring the highest quality of care for all of our patients. And we all benefit from the knowledge, experience, and expertise that these caregivers share with their civilian colleagues. In fact, many great improvements to modern medicine have their origin in military research, such as ultrasound, ice packs, reconstructive surgery, the EpiPen, even the ambulance, just to mention a few. That innovation continues today. Our colleagues in the federal health system are transforming themselves and redefining what it means to be a hospital in today's environment. Their innovations are providing leadership to the entire field as they lead the way in integrating new technology and providing care in novel ways to make services more convenient. And the private sector can certainly learn a lot from our federal partners when it comes to managing the total cost of care and coordinating patient care across the continuum.
Today's honorees embody the pursuit of excellence and innovation. Their leadership is an inspiration to all of us. Because the pandemic forced the cancellation of our last two annual meetings, where we normally present these awards, we'll recognize winners from both 2019 and 2020. Our first award is the AHA's 2019 Federal Healthcare Executive Award for Excellence. This award recognizes a senior federal healthcare executive whose leadership has contributed substantially to the mission of the federal healthcare system. AHA is pleased to present this award to Colonel Jennifer A. Brooks, MD, United States Air Force. Colonel Brooks championed the design, development, and launch of the Operational Medicine Clinic, the Air Force's first hospital-based, active-duty-only clinic designed to maximize an airman's readiness to deploy. The result? A big boost in military readiness. Colonel Brooks' efficient methods enabled more than 700 troops to be cleared for deployment in less than 72 hours. Out of the clinic, healthy and ready to serve. All this while Colonel Brooks maintained a 50% clinical workload. A tireless advocate for her staff, she prioritizes education and mentorship, ensuring that medical technicians and nurse practitioner students are able to rotate through her clinics. Her commanding officer said this has built support and optimism about the direction of the Operational Medical Clinic. Teacher, physician, and leader, Colonel Brooks contributes so much in so many ways. Next, we have AHA's 2019 Special Achievement Award. That recognizes the impactful work of Ms. Jennifer Koget, U.S. Department of Veterans Affairs. Ms. Koget has led a public-private partnership between the VA and the Fisher House Foundation to provide temporary accommodations for families of hospitalized veterans and active-duty service members. This means that military and veteran families can stay free of charge while their loved one is in a hospital. This successful program served more than 51,000 families and 61,000 guests from mid-2018 through 2019. In fact, Ms. Koget also oversaw the more than 22,000 volunteers in support of the Fisher House program. The result? Fisher House has saved the VA upwards of $37 million in out-of-pocket lodging costs. It has also expanded the program to 43 active houses and opened 6 newly built houses and provided comfort and compassion for tens of thousands of military and veteran family members. This blend of compassion, service, and smart economics is a special example of outstanding leadership in the field of federal healthcare. Through a serious illness or lengthy rehabilitation, Ms. Koget has provided a home away from home for thousands of family members. Now, let's move on to 2020 and pay tribute to 2 more superb healthcare leaders. The AHA is honored to present its 2020 Federal Healthcare Executive Award for Excellence to Brigadier General John J. Bartrum, United States Air Force. General Bartrum was appointed to a key role in America's COVID-19 pandemic response. He's a recognized expert in medical emergency response supply, acquisition, and innovation. Through one of the most difficult chapters in our country's history, he provided leadership in the design of what became known as Operation Warp Speed, the national public-private effort to get vaccines into bodies as fast as possible. Operation Warp Speed's innovative work with pharma companies and its assistance with vaccine distribution resulted in millions receiving vaccinations in a remarkably short time and getting the nation closer to the end of the pandemic. Experts call it nothing short of a miracle. General Bartrum helped smooth out supply chain issues with masks and other equipment, and also improve the effectiveness of the government's medical response to states, territories, and tribal nations. In our nation's hour of need, General Bartrum was mission ready, and America thanks him for his leadership. And our last award is the 2020 Special Achievement Award. This award recognizes a career federal health executive who has distinguished him or herself through a significant achievement that has enhanced their organization's mission or contributed to the improvement of the federal healthcare system. AHA is pleased to present the Special Achievement Award to Lieutenant Colonel Jason P. Richter, Medical Support Squadron Commander and Medical Group Administrator, Aviano Air Base, Italy, United States Air Force. Lieutenant Colonel Richter has demonstrated exceptional leadership, innovation, and teamwork as he and his team pursued creative and lasting solutions to problems previously unsolved. Lieutenant Colonel Richter was among the first in the Air Force to create a Chief Experience Officer position and lead efforts to create a telehealth program. Through data-driven analytics, he was able to resolve disparate care gaps within the base medical clinic and help shape the clinic's continuous process improvement program. And at the epicenter of the world's outbreak of COVID-19, Lieutenant Colonel Richter led his teams through a series of breakthroughs that were adopted at other facilities. His medical group's laboratory was the first Air Force treatment facility with testing capabilities. As his commanding officer noted, when it comes to taking the best care of patients and staff, he always finds a way to say yes, even when confronted with barriers and challenging circumstances. Lieutenant Colonel Richter's can-do attitude and leadership skills helped establish a culture of innovation and teamwork. Overcoming barriers and challenging circumstances is daily business for the honorable men and women who serve in the federal and military healthcare systems. We appreciate their contributions, and we salute their achievements.
Congratulations, General Bartrum, Colonel Richter, Colonel Brooks, and Miss Koget. We are so proud of you. You are truly remarkable people making a significant difference in healthcare for so many. Your leadership helps keep our country strong, our service members healthy and protected, and provides great care for those who have honorably served our country. We are grateful for your service and appreciate this opportunity to honor your achievements. Thank you for all you do to advance health in America.